Hi there, I'm Dr. Candice Bovell, a registered clinical psychologist. If you are an adult living in Ontario and experiencing anxiety, stress, or depression, I'm here to help.
What is obsessive compulsive disorder? Most people have had obsessive thoughts or compulsive behaviors at some point in their lives, but that does not mean that we all have some OCD. Obsessive compulsive disorder, or OCD, features a pattern of irrational thoughts called obsessions. Common obsessions include fear of being contaminated by germs or dirt or contaminating others, fear of losing control and harming yourself or others, intrusive sexually explicit or violent thoughts and images, excessive focus on religious or moral ideas, fear of losing or not having things, order and symmetry, the idea that everything must line up just right, and superstitions, where one pays excessive attention to something considered lucky or unlucky. Obsessions trigger anxiety that can often lead you to do repeated behaviors that are called compulsion. Common compulsions include excessive double-checking of things such as locks, appliances, and switches, repeatedly checking in on loved ones to make sure they're safe, counting, tapping, repeating certain words, or doing other senseless things to reduce anxiety, spending a lot of time washing or cleaning, ordering or arranging things just so, praying excessively or engaging in rituals triggered by religious fear, and accumulating junk such as old newspapers or empty food containers. These obsessions and compulsions interfere with daily activities, are time-consuming, and cause serious distress. If you have OCD, you notice that your obsessive thoughts and compulsive behaviors are irrational, but you feel unable to curb them and break free. OCD is a severe disorder that requires psychotherapy, and evidence-based treatment is available from WellnessView Psychological Services Ontario. Treatments for OCD include relaxation training and behavioral activation, which involve regularly practicing breathing exercises, relaxation exercises, and engaging in activities that are relaxing, enjoyable, or useful. Exposure with response prevention that involves gradually exposing yourself to what you fear and not avoiding or using a compulsion to escape from the situation. And mindfulness-based cognitive therapy that teaches you how to be in the present moment on purpose in a non-judgmental way. A minimum of 8 to 10 therapy sessions is recommended.
If you would like to book an appointment, please visit www.wellnessview.ca and complete the confidential screener.
Thanks for watching. Please like and subscribe.